Hello, everybody. Welcome to Miss Maguire video lectures. And today we're covering the cardiovascular system, the heart. This is part 1, anatomy only, and I'm using OpenStax Anatomy and Physiology textbook. So let's go ahead and begin. I'm sorry. All of a sudden, I'm not on my second slide. I'm gonna fix it. Okay, so that's my first slide. Okay, so where your heart is located? It's located in the mediastinum. Mediastinum is anatomical region of your body that is behind your sternum or breastbone. So it's actually shown here with this lines, dotted lines. And mediastinum is divided into inferior part, that's called pericardial cavity, and superior part, that is called superior mediastinum. So heart sits in the pericardial cavity. Now lateral to the heart are lungs. And we have right lung, that's the right side, and left lung. And the right lung has 3 lobes. Left lung has 2 lobes only, because heart is located a little bit off midline towards the left. So it's moved to the left, and it occupies some space of the left lung, and that's why left lung has only 2 lobes, and it has this notch. It's called cardiac notch. So your heart is about the size of pine cone or your fist, and it's about 300 grams. And it varies, of course, from person to person. Now, heart has 4 chambers, a human heart. So if I would draw a very simple diagram of the heart, so I would draw it kind of like this, right? And I would have 2 upper chambers and 2 lower chambers. So this would be my atrium, and this would be ventricle and ventricle. So here's the ventricle, right? Here's the atrium. So we have right atrium, left atrium, right ventricle, left ventricle. So atria, left and right, they are receiving chambers, and they push blood to ventricles. Ventricles, left and right, they are pumping chambers. So they're gonna pump blood to your body. And your heart will pump blood to the lungs, and then we call it pulmonary circuit. So it's a circulation between heart and lungs. I try to make this line straight. I swear, but or your heart can pump blood. Yeah, it always does, as long as you're alive. Your heart pumps blood to your entire body, and we call it systemic circuit. Systemic because that brings blood to your body systems, and pulmonary means lungs. So that brings blood to your lungs. Now, heart has several membranes. I'm sorry, I think this is, surrounds the heart is not, epicardium surrounds the heart. That's absolutely correct. So let's look at this picture. Kind of, this is a chamber, right? This is the piece of the heart. So that's your ventricle over here. So here you would have blood, right? So here you would have your blood. Now, inside the chamber, you have endocardium. Then the heart muscle itself is called myocardium. Then the heart is covered by epicardium. And epicardium has 2 names. You can call it epicardium, or you can call it visceral pericardium. So that's the same stuff. And you have visceral pericardium, and you have parietal pericardium. Pericardium is a serous membrane. Serous membrane always has 2 layers, visceral layer and parietal layer. And what we have between them is cavity. So that's a pericardial cavity in between visceral and parietal pericardium, and there is a serous fluid inside. And then we have another layer that is called fibrous pericardium. Now, mesothelium is that membrane of the epicardium and parietal pericardium that secrete that serous fluid. Surface features. So we have auricles, and auricles are leaf-like structures. So here, for example, is the auricle. So auricles sit on top of atria, and they can fill with blood, so they increase the volume of atria. Then we have sulci, and like in your brain, you have like part of your brain goes up, you call it gyri, and then we have, you know, fissures that go down, we call it sulci. So here we have sulci as well. So it's kind of like some grooves on the surface of the heart, and inside those grooves we have blood vessels, right? So we have coronary sulcus that go kind of around the heart, and we have anterior interventricular sulcus that is right here, and a posterior interventricular sulcus right here. So it tells you interventricular means that sulcus between two ventricles on anterior or posterior side of the heart. So layers of the heart from superficial to deep, so epicardium, myocardium, and endocardium. And you can see this myocardium, it's really like a pretty complex pattern of muscles. It's not just, you know, like nice box looking structure. It has all these, you know, fibers, muscle fibers goes in different directions. So that's what it says. It's complex pattern. Muscle layers of cardiac muscle cells has pretty complex pattern. Now, if you look at myocardium of ventricles, left and right ventricle, their myocardium gonna look different. And the left ventricle gonna be way thicker wall. So you see how thick it's over here or over here. Compare with, that's a left. Compare with the right one that is pretty thin, right? So again, this is right, this is left. And you see even in a contracted stage, right ventricle is thinner than left ventricle. And they do pump the same volume of blood, but the left ventricle must generate more pressure because left ventricle gonna pump blood to your entire body, including your fingers and toes. So your heart is here in the mediastinum, then you pump blood so it can reach, you know, your extremities. When the right ventricle gonna pump blood to your lungs, and you know, lungs are pretty close to the heart. Okay, we also have heart septa. Those are structures that separates, you know, ventricles and atria from each other, right? So we have interatrial septum. It tells you that's between two atria. Then let's skip this for a second. And we have interventricular septum, and this one separate ventricles. So on this diagram, you really only can see interventricular septum, right? So it's right here that separates right and left ventricle. Septum premium, the premium means something at the beginning. So that was the premium, I mean, it was the beginning of the septum that separates the atria, right, during embryonic development. And atrioventricular septum, it's not this one, because look, if you look this right atrium, right, what am I writing? Right atrium, and this is right ventricle over here. There is no septum between them. There is a valve. When it says atrioventricular septums, it's actually septum between right atrium and left ventricle. So there is a small septum that we cannot see here either, but it separates right atrium from left ventricle. And then we have valves. We have 4 valves in the heart. We have 2 atrioventricular valves. So between atria and ventricle, right? Atrioventricular. And we have semilunar valves, and they are between ventricles and blood vessels. So one of them is pulmonary valve and another is aortic valve. So they are semilunar valves. So two semilunar, two atrioventricular valves. Then we will continue talking about it in a minute. Now, right atrium receives blood from systemic circulation. That means right atrium receives deoxygenated blood. It receives blood from your body systems, or your body systems, they're using oxygen. They produce carbon dioxide as a metabolic waste product. So if something receives blood from your body systems, it's gonna be blood rich in carbon dioxide, deoxygenated blood. It has muscle, it's called pectinate muscles, and the valve that divides right atrium, right? So, right atrium and the right ventricle is tricuspid valve. So this picture is not the best one. So let's look over here. You see this valve over here. So we're on the right side. So that's my right. So right atrium and right ventricle. So the valve over here, right? Gonna be, I'm thinking where it's already tricuspid valve. And now tricuspid valve, the same as bicuspid valve, will have these structures over here, right? Those are connective tissue. It's called chordae tendonae. And they will be attached to these muscles right here. And those are called papillary muscles. So the same is true for the bicuspid valve right here. So we have, so we call them AV valves, AV valve, or tricuspid, or so it's right AV valve is our tricuspid, and left AV valve is our bicuspid or mitral. And bicuspid and tricuspid means they're just made of 3 or 2 cusps. So that's like 3 parts. And both AV valve have chordae tendonae, and they attach to chordae tendonae are attached to papillary muscles, and this prevents valve from collapsing back, protrusion back inside atria when ventricles contract. So if you imagine, if I don't have this chordae tendonae and ventricle contracts, the valve will be prolapsing back. So it will, it will be pushed back inside the atria. And if valve is pushed back inside the atria, blood can go inside atria, but we want a blood go from atria to ventricles, not from ventricle to atria, right? So it's what it says. It has a tricuspid valve. It does have pectinate muscles. Right ventricle also have, so right atrium. Right ventricle has this chordae tendonae that we just mentioned, papillary muscles, we talk about it. This muscle over here, the muscle of the walls, are called trabecular cornea. There is a moderator band, not in a human heart, but it's shown over here, moderator band. So if we dissect sheep hearts, then we will see this moderator band, not in human heart. And the right ventricle pumps blood to pulmonary trunk. So right ventricle to the lungs. Right atrium receives deoxygenated blood. Right ventricle pumps blood to the lungs. Now left atrium also receives blood, but that receives blood from lungs now, from pulmonary circuit. And then from left atrium, blood flows to left ventricle. And atria contracts, but blood flows pretty much on its own. Only 20% of ventricular filling because of atrial contraction. That's what it says. Left ventricle, thick muscle layer, also has trabecular cornea, also has papillary muscles, and it pumps blood to systemic circuit. So you can see over here, right atrium receives blood, left atrium receives blood, right? Then blood from right atrium flows to the right ventricle, from left atrium, left ventricle, and you see how it's shown here, blue color kind of represents deoxygenated blood, and red oxygenated blood. And then from the right ventricle, we're gonna flow to the lungs. And this blood vessel is called pulmonary trunk because we have lots of carbon dioxide here, right? So here's our carbon dioxide. So where would be a good place to take it? If I have lots of carbon dioxide, let's take it to the lungs and get rid of it. Now, in lungs, you will pick up oxygen, and then you bring this blood back. Now it's rich in oxygen, oxygenated blood, to left atrium, left ventricle. And then where is a good place to go? Well, let's go to aorta and to your whole body, because we have oxygen to deliver, right? So that's how blood flows through the heart. And left ventricle has a thicker muscle wall, right? Because it's need to pump blood with more pressure, right? So the blood can flow to the distal parts of your body. Okay, so here's our valves. We have right AV valve. We have pulmonary, mitral, and aortic. Okay, and they just call it mitral valve, but it's a left AV valve. Okay, so let's put here left AV valve. Yeah, it is called mitral valve, right? Or bicuspid valve. So right AV valve, left AV valve, between atria and ventricles, pulmonary valve, and aortic valve. So right AV valve is tricuspid valve between right atrium and right ventricle. Pulmonary valve, it's a right semilunar valve between right ventricle and pulmonary trunk. Left AV valve or mitral valve is bicuspid valve between left atrium and left ventricle, and aortic valve is aortic semilunar valve that between right, I'm sorry, that's not right, between left ventricle and aorta. Let's go ahead and change it. Not right, left. I'm sorry, because, you know, that came with the book. So we're fixing stuff over here. Now, obviously, aorta, how we go from right ventricle, right? We go from left ventricle because left side is full of oxygen, right? So let's double check. As long as I know that's a left ventricle, right? Left ventricle, blood rich in oxygen, we go to aorta. Here's aortic valve, left ventricle and aorta, not right ventricle and aorta. Okay. So when blood flows from atria to ventricle, of course you want atrioventricular valves to be open. You flow from atria to ventricle and there is a valve between them, so we want it to be open. And when AV valve opens, semilunar valve closed. That makes sense, right? When we flow from ventricles to great vessels, pulmonary trunk and aorta, we want semilunar valves open because they between ventricle and great vessels, and then AV valve closed. Now, coronary circulation. So your heart taking care of all your body organs, right? It takes care of your brain, liver, kidney, I don't know, pancreas, small, large intestine, your muscles, your skin. So your heart pumping blood to all those organs, but your heart is pumping blood to itself as well. So those blood vessels that supply your heart are called coronary circulation. And we have coronary arteries and we have coronary veins. Now, coronary veins, we really call them cardiac veins. I know, just to make stuff even more confusing, right? But we don't call, in their names, you see cardiac, not coronary. In the arteries, you see coronary. Okay, so let's look at some of them. So we have epicardial coronary arteries. So they are on, supply epicardium. So we have circumflex artery that is right there. Right, so here's the circumflex artery. Then we have anterior interventricular artery that will be right here. It's on anterior side and it's between ventricles. So it's anterior interventricular artery. Then we have marginal artery. Marginal means they are on a, on a margin, on a side, right here, for example. And here's another marginal artery shown here. So we have marginal arteries. I think that's the same artery. Yeah. Then we have posterior interventricular artery. So that's going to be this one on the posterior side. Here's the posterior interventricular artery. Right, so how many we covered so far? Circumflex, anterior interventricular, posterior interventricular, marginal. And right there, where we have anterior interventricular artery, we have great cardiac vein. Where we have posterior interventricular artery, right there. We have middle cardiac vein, so we have great cardiac vein, we have middle cardiac vein. Then where you have marginal artery, you have small cardiac. Actually, you have like a lot of small cardiac veins. They're shown right here, like, oh no, yeah, oh no, that's a small, yeah. So those anterior cardiac veins is also small, and then small cardiac vein is where you have your marginal artery. Marginal artery, small cardiac vein, anterior cardiac vein, I think that's it. So we have great cardiac vein right here. Then we have posterior cardiac vein. Oh, we didn't show this one. It's right here, where we have another marginal artery. So that's a posterior cardiac vein, right there. So we have great cardiac vein again. We have this posterior cardiac vein. We have a middle cardiac vein. We have small, over here, small cardiac vein, and we have anterior cardiac veins. And we have way more than that, right? And they form anastomosis, so they interconnect, making sure your heart gets enough of the blood supply, right? So again, anterior interventricular artery, great cardiac vein. Posterior interventricular artery, middle cardiac vein. Then we have circumflex artery, and it's actually it runs together with great cardiac vein still. So that's our circumflex, and this is great cardiac vein. And then we have posterior cardiac vein right here. We have a small cardiac vein right there, and we have anterior cardiac vein. Now, all this cardiac vein, they come together to this structure on the posterior side of the heart that is called coronary sinus. And those are veins. So, right, you see they blue over here. Not all veins blue, but those are blue veins. So they're gonna bring carbon dioxide rich blood. All carbon dioxide rich blood is delivered to right atrium. So coronary sinus gonna empty into right atrium. Now, coronary blockage, if we have coronary artery disease, if we have like plaque of cholesterol building up, then the artery can narrow, or so the blood supply either decreases, or it can completely stop the blood flow through this artery, and it can cause heart attack, right? Now, cardiac muscles. Cardiac muscles are very interesting because they are orthorhythmic cells. So they have property of orthorhythmicity. That means they can initiate electrical potential, electrical impulse. So your heart doesn't need to receive signal from your brain to contract. You have special cells within a heart muscle that gonna initiate electrical impulses on its own. So that's why we have two types of cells. We have myocardial conducting cells. Those are the ones that gonna generate these impulses, and myocardial contractile cells, and those are the ones that will contract. So either conduct, they will generate electrical impulse and conduct electrical impulse, or cells that will contract. Now, between cardiac muscle cells, we have a structure that is called intercalated disc. And those are a junction. It has like desmosome and gap junction between cells, and it's allow this electrical impulse to move directly from cell to cell without going to this chemical synapse. So intercalated discs, they bind adjacent sarcolemas, and sarcolemma is cell membrane of cardiac muscle cell. Now, we just said that we have these conducting cells, and those conducting cells, they make conduction system. This is where electrical impulse is generated and it's propagated. So it moves along these conducting cells. So each cell can generate its own fastest cell set, give you this contraction rate, and the fastest gonna be this SA node. So we have SA node over here. Then we have AV node right there. Then we have this bundle, and this bundle is called AV bundle, Atrioventricular bundle of his old name. Then we have bundle branches. So if this is bundle, those are bundle branches, right and left bundle branches. And then bundle branches gonna divide, they're gonna branch into Purkinje fibers. So here we will have Purkinje fibers that carry this electrical impulses to the rest of the heart muscle, right? SA node, AV node, AV bundle, bundle branches, and Purkinje cells, they're branches of AV branches. Okay, so pacemaker is SA node, right? It's initiate the rhythm of contraction, and we call it sinus rhythm. So normal rhythm of contraction, and you know your heart is contracting. The normal rhythm, like 70 beats per minute, right? This is called sinus rhythm. And it's go to from SA node, right? So we go from SA node, so you see these little arrows, to AV node, from AV node to AV branch, and then we AV bundle, this AV bundle. So we go to AV bundles, that bundle branches, and then Purkinje fibers, right? So SA node at rest, then SA node initiate action potential, that's your electrical impulse. Then action potential, electrical impulse, reaches your AV node, and then it has some delay over there. And this delay is needed so the atria can contract, right, and then relax. So it's give a little bit time for atrial contraction. And then we have AV bundle, right? It's a bundle between atria and ventricle, then bundle branches and Purkinje fibers, and then action potential spread to muscle fibers, to the whole muscle fibers, and contraction begins, right? So, and this AV bundle is between atria and ventricle, and bundle branches are within the interventricular septum, right? And then, you know, like electrical impulse goes to the rest of the heart. So here you can see this conduction system just on its own, right? How we have this SA node, right? And how the impulses move to AV node. And there is some, Beckman's bundle over here that bring impulses from right atrium to left atrium because SA node is in the right atrium. Then we have this bundle of His or AV bundle. Then electrical impulse moves through the bundle branches. And here we have all our Purkinje fibers that innervate, I would say, right? Or excites all the muscles of your ventricles, and then ventricles contract. So it says AV bundle divides into AV bundle branches. Left branch supplies left ventricle, right branch supplies right ventricle, and Purkinje fibers spread impulses to myocardial contractile cells, so those cells that will contract. And very quickly about, because we're talking about contraction, right? So what is our normal sinus rhythm? About 70 beats per minute, right? And if somebody has heartbeat more than 100 beats per minute, it's called tachycardia. And if somebody has heart rate slower than 60 beats per minute, it's called bradycardia, right? And tachycardia, if persistent, may lead to fibrillation when ventricle is just contracts so rapidly that it doesn't have time to relax and actually they pump blood out. And when it's bradycardia, it may result in an inadequate blood circulation, so not enough blood pumping. But like athletes, for example, when their heart is strong and big, then their heart rate is normally lower. So may have like physiological normal bradycardia. And this part over here shows us ECG that we will cover in physiology lecture. This was only anatomy part, right? And that was our last slide. Thank you for watching, and I hope it was helpful.